Hi, my name is Jessica O'Leary. I'm a registered nurse, and this is my presentation on skin cancer. So, skin cancer is the most common type of cancer globally. It arises from abnormal skin cell growth. You're going to see three main types. You're going to see basal cell carcinoma, squamous cell carcinoma, and melanomas. This is largely preventable with sun protection and early detection. My presentation today is going to focus on skin cancer, including the causes, progression, treatment options, and the role of patient education and follow-up care. Etiology and risk factors. UV radiation from sunlight or tanning beds, fair skin, light hair, blue-green eyes, family history of skin cancer, history of sunburns, especially in youth, and immunosuppression. UV exposure is the number one cause. However, genetics, complexion, and immune system health also play key roles. Epidemiology and prevalence. Over 5 million cases diagnosed in the US yearly. BCC is going to be our most common, and melanoma is the most deadly. More common in people age 50 and up, and you're going to see higher rates in Australia, New Zealand, and the southern US. So, like southern US, think about socioeconomic of like people who work outside more often, chronic sun exposure, and then other places where the sun is up more times out of the day. Skin cancer is highly prevalent, especially in fair skin population, and early detection drastically improves the outcomes. So, as far as progression of the disease goes, begins as a precancerous lesion, can involve BCC, SCC, or melanoma. Melanoma can metastasize rapidly. Tumor thickness and alteration are key prognostic factors. Understanding how skin cancer progresses is critically for early detection and intervention. Signs and symptoms. So, we may see new changing moles or lesions. And then later in patient education, we're going to talk about the ABCDE rule. So ABCDE, you want to look for asymmetry of the molar lesion, border irregularity, color variation, diameter, so greater than 6 millimeters, and evolving. So how is it changing over a time frame, okay? Bleeding, itching, or non-healing sores, pigmented lesions on palms, soles, or under nails. Educating patients about the ABCDE rule helps with early identification, especially in melanoma. Common comorbidities, we would say immunosuppression, chronic sun exposure, so like outdoor workers, history of other malignancy, genetic syndromes. These conditions can increase risk and complicate treatment decisions. Prevention and early detection. We want to use a broad spectrum SPF, so greater than 30 SPF sunscreen daily, making sure people are wearing protective hats or clothing, regular skin self-exams and annual dermatological checks, and public health campaigns to reduce tanning bed use. Skin cancer prevention is possible with consistent education and protective behaviors. Treatment options will have surgical, topical, radiation, and systemic. So for surgical, we'll see excisions or Mohs micrographic surgery. Topical, you're going to see different types of ointments that can be provided for early lesions. And radiation is used in non-surgical candidates. And then for systemic, we've seen different immunotherapies arise that people can have. The treatment choice depends on the cancer type, location, and stage. Definitely follow the recommendations of your doctor. Recent research, like I said, there are new immunotherapies, targeted therapies. Artificial intelligence is now used in dermoscopy and diagnosis. AI has become huge in diagnosing things. We also now at my hospital use it for CT scans. Genetic testing for personalized treatment. Research continues to improve survival rates, especially for advanced melanomas. For evaluation and coordination of care, we want to monitor, track, involve, and counsel. Monitor for reoccurrence every 6 to 12 months. Track response to treatment, tumor regression, lesion healing. Involve dermatologists, oncologists, primary care providers, and counsel for lifestyle changes, and promote sun safety or smoking cessation. Follow-up is essential to detect reoccurrence and manage long-term side effects of treatment. Like I said, for patient educations, we want to teach the ABCDEs of melanoma, demonstrate proper sunscreen application, address fears like body image issues of post-surgery. Some people get these on their face and they have to have large patches of their face removed. Encourage adherence to follow-ups and self-checks. Patient education empowers individuals to detect changes early and reduce risks. Barriers to treatment and adherence. One of our biggest barriers that we see across the board is going to be cost of medications, or special visits that they have to go to. Some people don't have health insurance and they can't afford these medications or these procedures. We may also see limited access in rural or undeserved areas. It's really hard to find a dermatology specialist. Psychological barriers like fear, anxiety, depression. Again, like I said, sometimes these people end up with big melanomas on their face that have to be removed. You might see a psychological barrier in, somebody not wanting the change of their appearance. And then maybe you might come across some different cultural beliefs about sun exposure. It's important to recognize and address these barriers during care planning. Supporting evidence. So I have a couple of articles here listed. This article makes a significant contribution to the understanding of the landscape of educational interventions aimed at improving PCP's skin cancer screening compatibilities. While it highlights the need for such intervention, it also points out critical gaps in current studies, particularly concerning long-term impact and clinical practice changes to improve the effectiveness of these interventions. Future research should focus on standardized evidence-based practice curricula and measures both immediate and long-term clinical outcomes. Given the central role of PCPs in early skin cancer detection, addressing these gaps could potentially reduce skin cancer morbidity and mortality, particularly in undeserved populations. For this article, overall, the article serves as a valuable resource for primary care physicians seeking to improve their ability to detect skin cancers early and provide appropriate patient care. The structured framework for skin exams, emphasis on patient education, and referral protocols are a strength that will undoubtedly aid practitioners in detecting skin cancers early, potentially saving lives. However, there are areas where the guide could benefit from more depth, particularly in addressing barriers to care, patient compliance, and the management of rarer skin cancers. By addressing these limitations, this guide could become an even more powerful tool in the fight against skin cancer. For this article, the review addresses an important public health issue given the increasing rates of skin cancer worldwide. Its focus on primary prevention through education has the potential to significantly impact public health outcomes. However, the review could benefit from deeper exploration of how different education strategies work in tandem to produce more substantial behavior changes. Furthermore, considering the challenges associated with measuring long-term behavior change. It will be crucial for the review to include clear, reliable outcome measures that track sustained impact. The review has the potential to provide valuable insights into the effectiveness of educational interventions for skin cancer prevention, but it will need to account for complexities in behavior change. This article sheds important light on suboptimal engagement with skin cancer prevention behaviors in high-risk communities, highlighting the need for targeted education to improve adherence to preventive strategies. Although the study is valuable in identifying these gaps, it faces several limitations, including sampling bias, reliance on self-data, and a lack for long-term follow-up. Despite these challenges, the article serves as a critical reminder of the need for improved public health education on skin cancer prevention, particularly in high-risk regions, and it calls for further research and to refine strategies that can lead to lasting behavioral change. This article serves as a highly detailed, peer-reviewed, and clinically relevant educational resource for healthcare professionals involved in the diagnosis and management of skin cancer. However, it could benefit from better organization, reduced redundancy, visual enhancements, and a more patient-centered lens for a continuing medical education CME tool. It succeeds in delivering foundational and advanced knowledge, but may overwhelm less experienced readers for those outside dermatology. I also had a couple more references thrown in here that I used throughout the PowerPoint. I hope that you enjoyed my presentation. Thank you very much.